Pregnant and worried about your abs splitting up? By the end of this video, you will know if you have an abdominal separation and what to do about it, so you can prevent core damage and feel strong and confident in taking care of your baby in the postpartum period. Like Natasha, a first-time mom who followed our approach and found her core to be actually stronger postpartum than before pregnancy. Helping active pregnant moms stay confident in their body through the motherhood journey is what we do, and there's a link below to chat with me directly if you'd like to discuss your needs and see how we may be able to support you. Alright, so let's get on the floor and see if your core muscles are separating, or what we call diastasis recti in fancier words. I recommend testing for this in the second and third trimesters because it's pretty rare that people have a separation in their first trimester simply because they have not popped yet. So I want you to go on your back with your knees bent and lift your head and shoulders up slightly as you palpate the midline here, and see if you can feel a soft gap in between your abs. And I want to put an emphasis on soft here, like you should be able to go at least 1 inch deep into the tissues where the gap is in order to qualify as an actual gap. If you feel a firm tension and you can't go deep, then you're good. There's no concern here. If you have a soft gap, your next step is to try and feel the edges of your abdominal muscles on either side of the gap. So you really have to keep your head and shoulders up here, otherwise you won't feel that, and see how many fingers you can fit in between the edges of your abs and assess the width of that. So is it 1 finger you can fit in, or 2 fingers, or 3, or 4 or more? Now I want you to test that gap at various points along the midline. So 1 inch below the belly button, right at the belly button, and 1 inch above and 2 inches above. So that will be 4 measurements. And the reason why you should do that is because oftentimes diastasis can vary along the midline. And I find that with my patients, a lot of the time it is more separated above the belly button versus below. So we want to make sure that we're assessing it kind of throughout the midline and not just at one point, because we might miss it. Now I want you to note your findings, and don't forget to indicate how many weeks you are on your sheet. This way we know at what stage of your pregnancy these measurements were made, and we can refer to them in the future to compare. Now let's talk about the results and what that means. Now look at all of your measurements and take the widest point. If the widest point is 2 fingers width or less, it means you don't have a diastasis. So don't worry about it. But if you are right at the 2 fingers mark and you're in your second trimester, it's something we need to follow closely because it might increase as your bump gets bigger in the third trimester. But if you're like 37 weeks and you only got 2 fingers width here, I would not be worried about it because you will likely not get much bigger than this at this point. Does that make sense? If your widest point is between 2 to 3 fingers width, we consider it to be a moderate diastasis. This is where we need to start being more careful about the way we move, because there are specific movements that could make it worse, like crunches or planks, for example. And we will want to keep a close eye on that diastasis because it could become more significant diastasis as your bump grows. And above 3 to 4 fingers width, we're talking about a more significant diastasis. I highly recommend using a pregnancy support belt during the day in that case, just to reduce the strain on the abdominal muscles. I made a video about different pregnancy support options, which I will link in the description below if you're looking for one. For those 4 fingers plus separation, I also recommend getting a soft abdominal wrap that you should wear in the first month postpartum to help heal your diastasis. I will put a link below with the wrap I recommend if you're interested. And across the board, diastasis or not, it's important to keep your deep core strong throughout pregnancy to support your abdominal wall. Not only working on your deep core muscles can prevent a separation, but it can also avoid it from getting worse if you have one. Working on these deep core muscles during pregnancy will also help you keep your core in shape to accelerate your healing after your baby is born. And if this is something you need help with, we would love to support you. That's what we do. And you can book a call below if you want to chat with me directly. Try and do this assessment every 4 to 6 weeks to track the evolution of your core throughout pregnancy. Now, don't obsess over it. Like, there's no point in testing this over and over multiple times a week. And like I said earlier, doing this crunching movement is one of the things that we want to avoid with diastasis. So, you know, every time you're testing it, you're pulling your core apart. So by overly testing, you might make it worse. So it's okay to test it once in a while to see where you're at, but it shouldn't be something that you repeat over and over. Got it? Now, before we wrap up, I just want to tell you, please don't start obsessing about diastasis during pregnancy, because it's a natural process happening because there's a little human growing in your belly, right? And how wonderful it is that our body is adapting the way it does to allow that to happen. And in the process, some moms will develop a diastasis and some won't, and it's just the way it is. Sometimes, despite all your efforts to prevent it, it may still happen, and it's not your fault. What you should know is that postpartum, we will want to keep a close eye on your separation, and more importantly, make sure that you're working with a pelvic health professional to guide you through your healing. We're happy to support you through this if that's something you're serious about. Again, the link to book a chat with me is in the description below. Thanks for watching.